It is June. It is hot right now and Pride Month rolling on, and a good time to shed light on some of the importance of healthcare within the LGBTQ+ community. We have Dr. Travis Wheeler here with the Christ Hospital Health Network telling us more about it. So welcome, Dr. Wheeler. How are you doing this morning?
Doing well. Glad to be here.
Doing well with good wellness here. So why would you say members of the LGBTQ community, why are they at greater risk for health issues?
So the LGBTQ+ community does have some greater risk for healthcare issues, particularly increased risk for depression, increased risk for heart disease, dementia. A lot of that comes from some health disparities that they've experienced throughout life, maybe unlikely to seek healthcare, or some discrimination with previous healthcare experiences in the past.
So what are some things they should be seeking out if they're not already? So what services?
So definitely looking for a primary care provider that you feel comfortable with, that you can talk to, that you can trust. Those are things that I look for when I'm looking for a primary care provider. I recently joined the Christ Hospital Health Network and accepting new patients, so I would happily be a great resource. The Christ Hospital also has a website listing a lot of LGBTQ+ affirming providers.
How is that difficult for you as a doctor? So here you are a doctor, you have to have a primary care doctor. How difficult is that for you to find somebody who you feel comfortable with and you trust?
I think it's the same for myself as it would be for anyone else. You have to kind of vet that out and find someone that you feel comfortable talking to, that you feel heard, that you feel like you can be yourself with. Luckily, my primary care doctor is a friend from residency, so it worked out in my favor there.
That's great. You already had an in right there.
Right.
So what about some members of maybe the older LGBTQ+ community? Why do they find it more difficult to talk to their doctor, maybe than some of the younger generations who I think are used to oversharing in a way?
Right.
A lot of things just pop out on social media, but you know, when you need to get one-on-one with your doctor, it can be a totally different situation.
Yeah, and I think the older population of the LGBTQ+ community especially has been through so much. Some of them were on the forefront of the gay rights movement. They've lived through homosexuality being a psychiatric disorder. They've lived through the AIDS epidemic, marriage equality. So they've had some negative interactions with the healthcare system.
All right, so what would you say the first thing that anybody should do when they go to look? Let's say they're coming to you to talk to you about being your primary care doctor. What's the first question they should always ask, no matter who they're turning to?
I think it's very reasonable to ask, are you comfortable treating someone in the LGBTQ+ community?
Okay, that's a good way to get it started, right? Start the conversation now. So where can we get some more information from you? Because I know the Christ Hospital is welcoming for anybody.
Absolutely.
We know they have a great history here. What do you think they should do in terms of going, do we go online first and fill out an application to get a primary care physician from Christ Hospital, or do they just call you directly?
So they can call the office, they can go online to the Christ Hospital's website. We have a Pride page that lists a lot of affirming doctors and links to our bios and information to call to schedule appointments. That's
one nice thing about having everything online. You can go in, you can read up, and there are even some times where you just see what people put in their profiles, a level of comfort right there.
Right.
That's always great.
Absolutely.
Dr. Travis Wheeler, best of luck to you now joining the Christ Hospital Network. I'm sure we'll have you back on to chat more again.
Of course.
Good stuff. All right, so don't forget to check that out there at the Christ Hospital Health Network. Let's check in and get a